Welcome to Mr. Doctor today. Today's case shows a detailed big tartar removal, a full deep cleaning procedure that brings back the nature of beauty of the teeth.
Tartar doesn't appear suddenly. It forms quietly, layer by layer, from the moment we finish eating. Everything starts with plaque, a soft, invisible film of bacteria that coats the teeth. The moment food particles, sugars, and saliva mix, plaque begins to develop. If it isn't removed within 24 to 48 hours, it starts hardening into tartar. Think of plaque as the wet cement and tartar as the final hardened concrete. Once it becomes tartar, you can't brush it off anymore. That's the point where professional cleaning becomes the only solution. And this is the part most people don't know. Even people who brush daily still get plaque in areas their toothbrush can't reach. Between the teeth, under the gums, behind the molars, these spots are breeding grounds for bacteria. As plaque sits there, it calcifies, turning into that yellow or dark brown crust that wraps around teeth. This is how tartar begins. Slow, sneaky, and always building up in the background. When tartar forms, it doesn't just sit on the enamel. It traps bacteria under the gum line. Those bacteria release toxins that irritate the gums. That irritation becomes inflammation. Inflammation becomes swelling. Swelling becomes bleeding. And bleeding is the earliest sign of gum disease. Many people think their gums bleed because they brush too hard, but the truth is simple. Healthy gums do not bleed. They bleed because tartar has already formed a barrier around the teeth, blocking proper cleaning. Once that barrier grows thicker, it pushes the gums down. That's how gum recession starts. The gums pull away from the tooth, creating pockets. And inside those pockets, more plaque, more food, more bacteria, more tartar. It becomes a cycle that slowly destroys the foundation of your teeth without causing pain until it's too late. When patients arrive for a professional cleaning, most of them have no idea how much tartar is packed under their gums. What looks like a harmless yellow stain on the front tooth may actually be a large mass of hardened calculus underneath. This is why every cleaning begins with an examination. The dentist checks for gum depth, inflammation, pocket size, and bone loss. They look for teeth that wiggle slightly, gums that are shrinking, and tartar that is embedded deep. This inspection reveals the true damage, sometimes years of buildup hiding behind a simple smile. Only after this full assessment does the real work begin. The first tool used is the scaler, either manual or ultrasonic. The manual scaler is a sharp metal hook used to scrape tartar directly. The ultrasonic scaler uses high-frequency vibrations combined with water. This tool cracks tartar off like breaking stone. The sound is sharp, almost like scratching glass.
That was today's big tartar removal. If you enjoy watching, don't forget to like, subscribe, and stay tuned for more satisfying dental transformation. Only on Mr. Doctor.